The number of cases globally, new cases globally of cervical cancer is more than 570,000. And out of this, around 300,000 of them, more than 300,000 die. A woman is dying every 2 minutes, and that's very tragic. And at the same time, we have the weapon to prevent this from happening. We have the vaccine, we have diagnostics, and we have also treatment. And when you have all this, and a woman is dying every 2 minutes, is not acceptable. So that's the tipping point. So people say, no, this is not acceptable and we have to do something. Then that led into launching the elimination campaign. It can also help in narrowing the gaps between the high income, low and middle income, because as you know, we have more actually deaths in low and middle income countries compared to high income countries. Australia is a model, and it's the first country to start actually a national program. Not only that, colleagues from Australia like Ian Fraser, who contributed to the development of the vaccine, were at the forefront campaigning for this. But in addition to Australia, since many other countries have started incorporating vaccination against cervical cancer in their routine immunization, they were in support of moving into elimination. So it came actually from Australia and other member states, other countries, who say it's time now we move, and the success in Australia helped. From the low income, we have Rwanda, which has achieved the highest coverage of vaccination against HPV, and that actually is also very motivating, because we're not talking about high income only, but even low income countries are doing well. And more than 90% coverage actually in Rwanda is very exciting. I think if you take the vaccination, it's a matter of strong primary health care. And then the screening, the same. If you have strong primary health care, then the screening can be done. So both can be done at the lowest level of the health systems by just strengthening the primary health care, and strengthening primary health care is not really capital intensive. So many countries can strengthen their primary health care. The most difficult part is the management, especially cancer treatment, which needs a strong referral system and specialized institutions. But then going back then to the first two, for instance, vaccination, still in terms of providing service, it can be done at primary health care, and screening can be done at primary health care, but there are challenges in the two areas too. For the vaccines, it's the cost. And now we're facing global shortages, and that may be the difficult part, even when you have the system and also the country's interest or readiness to use. Cost could be a barrier, so we have to address that. And on screening, the same thing. We have already diagnostics, but we need more affordable tests, so that's why we need to continue with research and also increasing the supply in terms of the vaccines, and even more options for vaccines. So summarizing it, the first two, easier to deliver, but you need to have the vaccine and you need to have the diagnostic tools. So it's a matter of cost. I think that becomes a barrier. And for the treatment, especially if it's a treatment that needs high-level referral, that becomes very difficult, especially for low-income countries and middle-income countries. Cervical cancer elimination can strengthen what we are now advocating and promoting, universal health coverage, and especially primary health care as its foundation. Because countries who go into elimination will always check what the investments needed at primary health care level and the whole health system. So that's what we expect. So cervical cancer elimination will be one of those programs that will help countries to strengthen their health systems. We had a working group meeting recently in Geneva. What we have agreed is we will need more research, and we should be part of the elimination, and we need more research in order to have more options in terms of vaccines, more options in terms of diagnostics, and more options in treatment too. So it will be part of it. The elimination goal actually started from the countries themselves. They said it's time to move to elimination because the problem is serious, but at the same time, as I said earlier, we have the weapons. So it came from them, and WHO was convinced. Of course, WHO is also considering that. The central issue would be, without commitment, we cannot achieve elimination. And we believe that will be actually the major ingredient for the success of elimination, that they have to continue to strengthen their health system, and the political commitment should really be as stable as possible. Since no country is the same as another country, we have to tailor the response based on the situation. So that's what we're trying to do, and WHO will provide technical assistance based on their situations. You have Zambia now, which is using a technology, mobile technology, especially in screening, combining the screening and treatment. So as soon as the screening is done, then the treatment also follows, the pre-cancer treatment. Then another example is from the high-income countries, Canada, and progressing well. Then another country maybe from Latin America is El Salvador. Of course, these are the front runners, but there are many countries who have already incorporated, for instance, vaccination in their routine immunization, and more than 90 countries, and we're encouraging more countries to do so. Not just as WHO Director-General, but as a person, I also share with others that we cannot really let this tragedy continue while we have the weapon at hand. And I was listening to a story, actually, a 26-year-old woman who was diagnosed with cervical cancer, and her uterus had to be removed, and that's the essence of her womanhood, and someone who was really wanting to have her own family, and suddenly there is a news that she can't. Imagine how many women we have globally who are getting this bad news, but who before the bad news had the dream to have their own children, their own family. And since we have the vaccine, we have to give hope to the world, so women will not face the same problem as those who are facing now. So I think those personal stories that were coming and who came in support of the elimination program moved us all, and we said we have to do something. And you will find the same stories in many countries, many countries. As a global goal, we say elimination is possible, but it's not easy. Even if you have the tools, if access to those tools is not possible because of a financial barrier, then the deadline for the elimination could be extended, and many women who would have benefited will not benefit. So it's going to be a tough journey, even if we have the weapons, because of the financial barriers we may have. But not only the finance or the costs of the vaccine, diagnostics, and treatment, the other problem that may affect the elimination program would be the weakness in the health systems. And there are many fragile countries. There are many countries in conflict. There are many countries, low-income countries, very poor countries, whose health system is really, really weak. So when we talk about elimination of cervical cancer, we have to side by side think about revamping or strengthening the health systems of those countries whose health system is really weak, meaning there should be global solidarity to support, to mobilize global support to those countries who need support. And that kind of support not only will help the elimination campaign for cervical cancer, strengthening the health system can help us even to fight communicable diseases. It would be like Ebola, or it could be like measles, because the health system is the platform, the vehicle for to address the other health problems that we have. So if you see it in this respect, the journey toward this elimination will not be easy. At least there are these two major problems: the barrier because of high cost of the tools or the products we have, and the weak health system, and we have to address both. And increasing the coverage as soon as possible, you know, the 90, 70, 90, will not be easy as a result. It's possible, but it will need a lot of effort, and it won't be an easy journey. But it's ambitious, 90, 70, 90, and we should really keep that target and have our 2030 the SDGs as a target for the elimination. Imagine addressing the tragedy of losing a woman every 2 minutes. What better story would you have? And then the other story is most of the deaths are happening in low and middle income countries. Helping those countries is a big story, so saving mothers. And then the other story is the good news, because countries like Rwanda have achieved the highest coverage in Africa. What was required was the political commitment. But even in resource-constrained country, achieving 9% of vaccination in girls is good news. So this is another story. So it's tragic, but we have a solution. And we have a solution because some countries have shown us how to do it. So it's not like a theory. This is something that's happening now. We can reverse this tragedy. A woman dying every 2 minutes can be reversed, and it's already happening. I think that's the story. There is a tragedy, a story, but there is also good news. And we should use the opportunity. It's time to really move on, because we can do it. It's happening. And I was happy when in May actually reading one news article about Rwanda would be one of the frontline countries to eliminate cervical cancer. And then, of course, when the same thing is said about Australia, it wouldn't surprise you because it's a high-income country. But then when Rwanda comes as an example, then that's it. That's the story. So the tragic story plus the story that can counter that tragedy, which is it's possible. And both high-income and low-income countries are showing the way.